Hello there, it's Archie. I'm back for the ADHD Care podcast. I hope you're doing well today. Thanks for locking in and joining us for this special edition of the podcast. I'm pleased to say today I'm joined by Ryan Wexelblatt, who is the creator of ADHD Dude. Some of you might be familiar with Ryan through his fantastic work in supporting parents of children that have ADHD and also his social media presence, particularly on Instagram. So Ryan has dedicated his career in terms of supporting parents, families with children affected by ADHD, motivated by his own personal experiences with ADHD and the lack of adequate resources for his son. Ryan has focused his career on addressing ADHD from different angles. His approach is quite unique and parent-centered, emphasizing skill building, behavior improvement, and emotional regulation. Ryan's qualifications and experiences, both personal and professional, have equipped him to provide the practical, real-world strategies tailored to the needs of children with ADHD. So yeah, let's bring Ryan on. So yeah, how are you doing?
I'm good. How's everything there?
Yeah, good. Just busy, but otherwise
Yeah.
good. Yeah,
Yeah. Do you do
yeah.
conferences there? Like, are there ADHD conferences like throughout the country?
We do conferences like in the UK. Yes, we do. I went to one last week actually on adult ADHD, but we have
Oh,
different
really?
types. Yeah.
Just for
We have some in
adults.
New.
Okay.
Yeah. So we have some like in the UK. We went to one in Amsterdam as well. So there's the European ones as well. I don't know if you're familiar with the ADHD.
Yes.
Yeah,
In Amsterdam, I know that one. That's a big conference, isn't it?
that is a big conference. Yes.
Wow. How was
Yeah.
that?
That was good. So we had a few. Some of the speakers that came to the Chad conference were also at the Amsterdam conference. So like Russell, what's his name, Ramsey, he was
Yeah.
there, and a few from Europe. But I think it's more European based. So a lot of the speakers are from either sort of Europe, like Sweden, UK, Ireland. Have you been? Have you been to sort of this part of the world?
Yeah, but not to any conferences.
Ah, okay.
Yeah. That's why I'm curious about conferences there. Yeah.
Okay. Well, if you're not interested, I can obviously let you know if there is anything coming
Yeah.
up.
Yeah.
And
Please.
yeah, excellent, perfect. So I thought today we can discuss all things like in terms of your role, in terms of obviously how supporting families of children that have ADHD, and certainly talking about your personal experience as well of living with
Yeah.
ADHD. We met at the conference
Well,
at
my son,
Chad.
not me, but yeah.
Oh, sorry. Yeah, your
Yeah.
son.
Yeah.
And I think that was one of the things that made you kind of wanted to go into this field. Am I right in
Yeah.
saying that? Yeah.
Yeah. Mhm.
Okay. I suppose maybe if we could just start with that, to be fair. So, would you mind just sharing your personal experiences with ADHD and how it led you to creating ADHD Dude?
Yeah. So basically, I entered the special education field when I graduated from graduate school. I started working at a school for students with behavior challenges. And as you might imagine, most of them were diagnosed with ADHD. And I just kind of stayed in special education for a while and realized I liked it. And then, when I had my son, who I adopted as an older child when he was 8, he certainly came with his own set of challenges, not just behavior, but with executive functioning and social skills. And I started looking around for help for him in the area. And I'm from Philadelphia originally, which is, a big city. And I was looking around and I just couldn't find any help for him really. And Philadelphia has some of the best medical care in the States. And there were lots of things for kids with autism, and there was nothing specific for kids with ADHD, except a clinic at a hospital that really more just dealt with meds. So that's when I decided I have to take the learning into my own hands. And, I started first learning all I could about social skills because that was what was most important to me. And I found out I liked it the best. And then, he really struggled with executive functioning. So that was next. Interestingly, despite the fact his behavior was really challenging, that was not at the top of my list. I think because I was a little naive and thought I was more equipped to deal with it than I actually was for my years of school, but it's very different when it's your own child, obviously. So that's kind of, what led me on this path of doing what I do now. ADHD Dude really came about because I was always a school social worker, and I had a private therapy practice as well. And then when my son finished vocational school, we were going to move to the town where my grandparents had a beach house growing up. And I wanted to, just get my name out there and drum up some business. So I started putting some videos on social media, just showing the things that I had done with, kids and families in therapy for years. And then people just started to kind of take notice, and I didn't realize what I was doing was so unique, but apparently it was. So yeah, that's how it came to be.
And just to go back to your son, was he formally diagnosed with ADHD?
Yes.
At that time? Okay, right. But
Yeah.
when you came into this, was he diagnosed initially, or was he subsequently diagnosed?
No, before me. Yeah.
Oh, before you, right? Okay, I get
Yeah.
you. And certainly in terms of some of the challenges that you hear from families that you work with, seeking help with, particularly with who have children with ADHD, what are some of these challenges that you often hear from families and parents?
Yeah. So one of the things I'll tell you is I always say that, at least here in the States, I have a saying that families are unintentionally misled as soon as their child is diagnosed. And what I mean by that is, often a diagnosis comes from a pediatrician or maybe a psychologist, and then they refer them to, services or treatments that are not even, evidence-based treatments that are recommended by the American Academy of Pediatrics. So here in the States, the recommended treatment for children under 6 is to start with parent training, followed by medication management. And for children 6 and older, the recommendation based on evidence is parent training in conjunction with medication management. Well, what I learned was most families are never told that. They're basically, maybe, given the option for medication and then sent on their way. And, the doctor, the pediatrician or the psychologist says, go find a therapist or go find a play therapist. And really the reason why is just, a lot of people don't know the treatment recommendations. So I think, excuse me, I think that's been the biggest struggle, is for people to find effective help, not because it's not out there, but because they're pointed in the wrong direction.
On that point on parent training, 'cause if I think back, if I think to the UK, that's why obviously we have the nice guidelines similar to like what you have in the States in terms of what they recommend post-diagnosis for that age for children. These training sessions or courses, they're not readily available as much as they're being recommended. Like we have the National Health Service in the UK.
Right.
And again, they've, I'm sure you've heard of the waiting lists and
I have.
this, yeah. So there's lengthy waiting list to actually get the assessment. In terms of the treatment, once you get the diagnosis, it's usually medication or nothing really, or you get signposted elsewhere for, accessing other services. So yeah, as much as obviously the recommendations are being made, but what we're finding that, as I said, these things are not readily available. So parents are having to resort to having to go down the medication route for some anyway, that might not necessarily want to go down that route as first line.
Right. And I would say here, parent training is not easy to find, but part of the problem is a lot of the social service agencies that offer it do not advertise it. So unless somebody knows to specifically ask for it or really searches, it's quite difficult to find here.
Yeah. And again, parent training, it obviously has to be quite specific to neurodevelopmental, like neurodiverse needs of ADHD in this case, because there's different types of parenting training that you can access. Right. If I think back to when I first came to this field, there used to be like courses whereby parents could go before the child got the diagnosis. So they can learn about strategies and understanding the child and all of this and that whilst they're waiting on the list. And I think, again, with shortage of resources and things kind of disappearing for all sorts of reasons, we don't see that there is any of those that support the pre-diagnostic support, which I felt a lot of parents are benefiting from. So a lot of parents are having to then wait on the waiting list. Things are escalating. By the point where they actually get to be seen or assessed and diagnosed, you find that there might be some other comorbid issues that the young person is presenting with. And the behavior, if you want to focus on the behavior, is escalated to the point where in most cases, parent strategies alone wouldn't be just sufficient at that stage.
What you described is exactly the story I hear from many families in the UK. I mean, that exact, in that sequence as well. Yeah,
exactly, which is sad.
Yeah.
So again, just let's talk about ADHD Dude in terms of like what some of the work that you do in supporting families. What is it that you do sort of on a day-to-day?
Yeah. Well, my number one thing is I want to provide educational content to families that's based on evidence. And it's also based on my experience as a school social worker and father of a child with ADHD, and my clinical experience. So that's my main thing, is I put out videos through the ADHD Dude YouTube channel, which is obviously a free resource for families. And there's different playlists there. And then the other things I do is I provide parent training through a membership site, where there's a course on there's a parent behavior training program. There's a course on building the foundational executive function skills. There's a course on building what I call social executive function skills, which most people just refer to as social skills. And then there's some other courses as well, like setting daily expectations. So that was never intended to be my full-time job. I just did that, thought it would be helpful to some families, and it just kind of took its own life really quickly, in terms of just building a lot of interest. And now there's several thousand members, and it's what I do all day. And I provide
Wow.
office hours for parents so they can come and ask questions. One of the things I'll tell you that's really unfortunate in the States, and, I'm sure a lot of people there are not probably aware of, how our healthcare systems differ, but in the States, unless you would go to a social service agency that takes your specific insurance, parent training is not going to be covered by insurance. So my goal was, I wanted to keep this as cost effective as possible for families, knowing that, insurance is not going to cover it for them.
Um, when parents hear the word parent training, I'm sure you come across this. Sometimes it might come across as if it's a criticism on their part that they can't parent.
Right.
Some of them might be seeing it as also what you're trying to say, I can't parent my own child, sort of thing. So some of these stigmas are still there, and I hear that a lot when I'm in clinic, and I recommend and I suggest that, okay, this is the first route of treatment. I'm sure you come across this as well. What would you say to parents listening to this podcast who might be a bit more reluctant to go down the parent training route? What's the benefit of it?
Well, first of all, I would say that, your child's your child's ADHD related challenges have nothing to do with you personally. This isn't a parenting issue. And kids with ADHD do not come with instruction books. So what we're really doing in parent training is learning to parent in a way designed for the ADHD brain. And again, if that's not something you were taught to do, and who was, then that's where parent training, comes into place as a benefit. And really, what I would say is, part of the reason that I follow the American Academy of Pediatrics treatment recommendations is not just because it's from the organization, but it's because I find that they actually produce the best results for families in the shortest time frame possible.
And the actual specific types of parent training that you offer, when I came to the last CHAD conference last November, you were talking about NVR, nonviolent resistance, which we tend to use in the UK quite a lot for children that have certain types of behaviour which are causing significant issues in the family. What are some of the parent training sort of methods that you use?
Yeah. So I will say that really what informs, my approach more than anything these days is NVR, nonviolent resistance. I've just found, out of everything I've done, it's the most effective for kids with ADHD, and there's evidence to back that up. The other approach I really pull from is called the nurtured heart approach, which is out of the States. I find that's really effective as well. So yeah, those are really my two main ones when we're talking about behavior.
And for our listeners, particularly with NVR, because this is something I'm very familiar with when I worked in children and adolescent mental health services camps, would you want to just give us a quick snapshot of what exactly it is, the actual course itself?
Yeah. First of all, I have to tell you, it's so strange to me talking to somebody who knows what NVR is, because unfortunately it has no name recognition in the States at all. So this is this is unusual for me to talk to somebody who actually knows what it is. So NVR, nonviolent resistance, is work that initially came out of Israel, but has become, pretty well known in the UK as well as Germany. And really what it teaches parents is how to reduce parental accommodation. So basically, parental accommodation is when parents modify their behavior to avoid their child's, blow-ups or meltdowns, tantrums, whatever it is. So what parents learn in NVR is how to stop accommodating those behaviors. what to do when those behaviors, whether it's physical aggression, or being destructive have become problematic, and how do we intervene? It teaches parents, how to become the biggest presence in their child's life instead of TikTok or their phones and so on. And it really comes from a place of the whole idea of it is that you have greater parental presence in your child's life. And that's what really appealed to me about it, is that it's a very family focused approach.
When I think about parenting, I think obviously, as you know, there's different parenting styles. Do you think it's important as a parent to know kind of what style you are as a parent, particularly if there's two of you that go on?
Yeah, no, I definitely do. And, one of the things that I see here in the States, and I will tell you, I've seen increasingly over the past however many years, and I imagine it's the same in the UK. I've seen this shift away from, what is called the authoritative parenting style, which is, a combination of, clear limits, structure, combined with love, and it's not punitive. I've seen a shift away from that towards much more what we call the permissive, indulgent parenting style. And I really see in kind of the neurodivergent parenting space, that's really become much more prevalent. And what I've really seen is a lot of, of whether we want to say it's social media influencers as well as professionals, encouraging parental accommodation. So, so that's obviously disappointing because it's contradicting with what the research data shows, but really, everything that I pull from is based in, an authoritative parenting approach, which decades of research data have shown us produces the best mental health outcomes for kids, helps them most with self-regulation and helps them most with their self-esteem. And I think I should also mention, people often get authoritative confused with authoritarian, right? So authoritarian means, do what I say and don't ask any questions. That's not what we're talking about, right? Authoritative involves collaboration, with the child, but the parent is still leading the child. And I think that's a really important component for kids with ADHD, is that they feel that adults are in charge, because that helps them feel emotionally safe.
And I think the key message here as well, in terms of the parent understanding and accepting the child's diagnosis of ADHD, because as you know, sometimes ADHD could be seen as behavioral, or the child is choosing to behave in that way, or the inconsistencies, how come they can respond to one parent and not to the other parent.
Right.
This element of choice can confuse some parents to some degree, and they go, okay, there's an element of choice there, so they're choosing to act in this way, then, so, and I'm sure you hear this all the time when you're doing some of your work. Yeah. Moving on from that, I want to talk about emotional regulation. What do you think is the importance of emotional regulation skills in managing ADHD, and how to teach skills to parents when it comes to dealing with children?
So one of the things I always want parents to understand is that, there are some aspects of ADHD that may not go away in adulthood, or I should say maybe will not necessarily improve in adulthood. They'll improve somewhat, but they won't improve as much as if we intervene early on. So for instance, we know that a lot of adults with ADHD still struggle with emotional regulation. We know a lot of adults with ADHD might struggle socially, with understanding how they're coming across to others. I think the emotional regulation piece is the most important. And I would say that's the majority of work that I do through the membership site. Because it's what causes the most stress at home for families. And I think, people often veer to one direction or the other, such as you mentioned, like, this is a choice. My child is making the choice to be emotionally dysregulated. And in some cases they are, they might not be making the choice, but they're certainly making it worse because it's being reinforced with attention. And then I think, at the other end, we have, well, my child can't help it because they have ADHD and this is just the way they are and I just have to love them. Well, no, that's not helpful, right? Because then we're not teaching them how to, function in a world that is not going to accommodate them.
Yeah. For me, when I think of when you think of behavior, I see it as a function. Is the young person is trying to communicate an unmet need or something that they can't communicate verbally. So, and I suppose if you want to go down to actually understanding exactly where some of the behaviorals or the emotional disturbances might be coming from, there's something that might be driving that. And I suppose as a parent, you're reacting to what you're seeing, the meltdown, understanding, okay, the child is hungry, or they can't get their way, or they're tired, or all sorts of other reasons. And as parents, it's quite stressful. You're very busy to try and eliminate what could be causing that behavior.
Right. One of the things I'll tell you is, I see that a lot of kids with ADHD have really strong expressive language skills. So it's not that they don't know how they feel necessarily. It's not that they're not articulating it, but two things is one, they're not always having an internal dialogue with themselves, which I call brain voice with kids, meaning they're not always saying to themselves, you know what, I feel hungry right now, and I need to convey that to a parent or whomever, in a way that they understand. They're not thinking to do that, right? So they know how they feel, but they're not making the connection between I need to articulate that right now, because they can articulate it. But here's the other thing. I would say the number one thing I think parents don't understand is that, inflexibility is, or I'm sorry, cognitive flexibility is one of the core aspects of executive functioning. So it is very normal for kids with ADHD to struggle with being flexible. And often when they are being inflexible and not getting their way, that's when emotional dysregulation happens. And I think that's often when parents think, that this is willful, because they haven't been educated about the fact that inflexibility is an aspect of ADHD that we have to work on with kids. It's a skill to build.
When I think about ADHD symptoms, particularly impulsivity, that's something quite difficult to manage in general. Like if you think about it as a parent, like because it's a behavior or a reaction to things, or it's sometimes comes out of the blue. Some of the things like inattention, you can just about manage it. Obviously, if you know the young person struggles with focusing and hyperactivity, again, excess energy, you can channel that energy into some sort of activity. But impulsivity, that's a difficult one. That could be through emotions, like what you mentioned, through meltdowns. It could be through how they say. It could be a behavioral response. It could be anything. So, what advice do you give to parents managing impulsivity? And that's something I often hear as well. Parents asking me.
Yeah. So the first thing when it comes to impulsivity is I always want to be realistic with parents that in my, 20 plus years of doing this, I have never seen anything really help to help manage impulsivity except two things: brain maturity, which happens over time, and meds. And people will say, well, what about mindfulness meditation? And my thing is, if you want to try that for your child, go ahead. But the chances of them developing a mindfulness meditation practice are pretty limited. We can certainly teach them, to, delayed gratification. We can work on things like that. But at the end of the day, yeah, my experience has been that it's really, particularly for younger children, it's brain maturity and meds that are going to help with impulsivity.
How about social skills training? This is something, again, that I often hear being recommended for some children with ADHD and some children on the spectrum of ASD. Is that beneficial, particularly for ADHD, to learn understanding empathy, how other people feel, stop yourself from, think about what you say before you say it, all of that?
Yeah, so this is my favorite topic to talk about, actually, because this is what I've done the most training in. So
Right.
let me start off with, a few things. So what people often refer to as difficulty reading difficulty reading social cues or difficulty with social skills. That's what I call social executive function skills, because really what they are is that they are the executive function skills we use when we're sharing space with others. So for an example, one of the foundational ones is perspective taking. So understanding others' thoughts and feelings and understanding how you're coming across to others. That is something that many, not all, kids with ADHD struggle with, which often comes off as a lack of empathy. And in my experience, kids with ADHD often have a tremendous amount of empathy, but if they struggle with perspective taking, they're not always showing that. But let me tell you what the research data says on this, that the research data has shown that things like social skills groups are completely ineffective for kids with ADHD. So office-based or, clinic-based social skills groups, the research shows that there's no carryover of skills, outside of that, which is why I don't offer them. What I have always done, because I do provide school year programs is, and a summer camp as well, is, we do some lesson in, this social executive function skills area. And then, we go out on trips in the community. So the idea is that, there's a relevant context and there's teaching in the moment that's happening to, help generalize skills. But on top of that, the parents have to be taught the language as well that we're using, because the more that, with kids with ADHD, what we know is they have to be taught in the moment. That's how they generalize skills. So that's why parents really have the biggest role in this. And I think, educators can as well if they have, the training and the language to do this. But in terms of social skills training, yeah, the research shows there's no benefit for kids with ADHD.
On that point, on executive functioning, what strategies would you recommend for improving executive function skills in children with ADHD?
Yeah. So I guess one of the things I always want to differentiate is that people often think executive function skills means academic organizational skills. And really executive functioning are, these skills that we use in every facet of life, really. So I want parents to think of this beyond, organizing your school materials, but it's, things such as, learning how to conceptualize time, sensing the passage of time. It's helping to build nonverbal working memory, or your ability to visualize the end result of something or visualize something in the future. It's helping kids shift from what I call prompt dependence, meaning we're saying, go do this, go do that, put your shoes on, which is, parents acting as kids' executive functioning. We want to shift from that, towards independence. And we can do that by changing the way we use language and putting visual strategies in place. And when I say visual strategies, I don't mean lists and checklists, because those don't work for the majority of kids with ADHD, nor do timers. And I say this because those are the most common strategies parents learn, but interestingly, they don't work for most kids. So I have a lot of videos about this at my YouTube channel that I encourage people to watch, because it's free material, and I think it'll help them get a better sense of what it means to work on these foundational executive function skills.
And what age would you actually start to encourage this kind of promoting independence?
Yeah. So one of the things we always have to, think about is that for children with ADHD, their executive function skill development is approximately 2 to 3 years behind their same age peers. So what I say is we have to meet kids at their executive function age, not their chronological age. So really, we can start this as young as, 6, 5, begin to work on some of this.
And this is something, again, I hear in clinic as well. Parents saying to me, I'm sure you had the word scaffolding, where parents are literally doing everything and they've got everything micromanaging the young person. And then the young person starts to try to push away. They want to gain that independence for themselves, but the parents don't trust the young person to say, okay, you're going to organize yourself, pack your bag, make sure you got everything you need before you go out, all of that. And it's a tricky one. And this is usually around the teenage, sort of 14, 15, 16. I often hear parents saying that. And the young person just wants to be left alone.
Right.
Again, yeah. What would you advise to parents? And again, this is something I was talking to another parent the other day, and she was saying that how do I let go at the same time, trying to give them space, but at the same time, I don't trust them.
Yeah. Well, here's the thing I would say, ideally we should start working on this as early as possible, because what we often find, or what I often find, with teenagers, is that if they have a propensity to be inflexible to begin with, often between 14 and 15, I see that in flexibility increase. Okay. So and then on top of that, we have teenagers wanting more freedom, right? Wanting more independence. So what I explain to parents is that, if your child is 14, 15 and not receptive to help at that point, then we have to let them experience natural consequences of not accepting help. Okay. So, what I want people to understand is, if your child, forgets their, school report or whatever it is, it's not going to have a tragic effect on their life. Okay. If their only way that they're going to learn that I maybe need help with this is to let them experience natural consequences and not rescue them from forgetting things, not bringing their lunch into school for them every time they forget, because the more parents act as their executive functioning and the more parents pick up the slack, that takes away learning opportunities from the teenager.
Which is what you find when they sort of finish first, secondary school, they're about to start college, university. That independence is tested to the limit, really, for the most young people, where they have to move away from home if they move to university. Some of them drop out of university because they can't cope. It's just too much to know how to manage yourself, your finances, your everything,
Right.
which I get your point in terms of 14, 15, 16, to start introducing that, promoting the independence, so that hopefully by the time they're 16, 17, and then we have to move away from home, hopefully at that point, it won't be as daunting as, someone who's just been left to go, okay, here we go, 16,
Yeah.
after they had all this scaffolding from the parents.
One of the things I want to mention to your point is that, for many years, I would often get, calls from parents around sometime between October and December. And the story was always the same. My son went away to university and he's home now because he couldn't make it through his first semester. In all of those cases, it's never been the academics that they can't handle. It's not even the academic organizational skills. It's that they've never developed the independence to, as you mentioned, to manage their life. So when they're suddenly thrust into, to this, situation where they're expected to be completely independent, they don't have the skills to do that. And what the research shows is it's actually better for university students to do one or a combination of these. So, live at home while they're taking, their courses, take a part-time course load, or started in the States we call community college. I don't know if there's an equivalent in the UK. I guess it would be called
No,
college. Yeah, I think
college.
college is
Yeah,
what you
college.
call it. Yeah,
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 yeah.
yeah,
Yeah.
yeah.
So what we call community college in the States. So that's what the research shows is helpful to help students with ADHD be able to stay in school.
Let's talk about teenagers,
Mhm.
parents with young teenagers. That's a big milestone. There's a lot that comes with being a teenager, let alone having ADHD on top of that. As you know, the peer pressure, they're discovering themselves.
Mhm.
Um, they are trying to fit in as best as they can. Most of them, some of them not wanting to accept this whole ADHD or being seen as different, which can then cause issues in terms of them being engaging in things like medication treatment and stuff like that. Um, and I think a lot of parents do struggle with teenagers, really. And I'm
Mhm.
sure you come across this. If
Yeah.
we maybe spend some time talking about this, because I know that's something that another parent I was talking to was
Mhm.
asking in terms of like, okay, where do we start? So you got some parents that are coming in, the young person who's just literally been diagnosed with ADHD as a teenager, some who've had a young person diagnosed earlier. And I think if you compare the two, where a young person's been diagnosed maybe when they're a bit younger, maybe before the age of 10,
Mhm.
when they go through their teenage phases, it's slightly different to someone who's in their teens who's been diagnosed with
Yeah.
ADHD as well.
Yeah. Which part do you want me to comment on?
So let's start with the first,
Yeah.
teenagers and ADHD.
Yeah. Okay.
Yeah.
Um, so yeah, I think, it's interesting. I actually find a lot of the time the ones who are diagnosed later, they seem to be a little more receptive to help. I think because, they're kind of the ones learning about this is how my brain works. That's not in all cases, but I often find the ones who are diagnosed later tend to be a little more receptive, to help. Again, with teenagers, I mean, there's a few things. One of the biggest issues I see in families of kids with ADHD is what I call high giving, low expectations. Meaning parents, give the kids expensive smartphones and, video game subscriptions and this and that, and nothing's expected of the child in return, except for maybe academic performance. And a lot of the complaining I hear from parents, I can't get her to clean her room, or I can't get him to, help around the house. What I find is that they don't have any expectations in place, so that they're still giving the child all these things without any kind of, asking them to contribute anything. So that's one of the things, is we need to have expectations in place, not only because it teaches kids, reciprocity in relationships, but for kids with ADHD, they need to feel useful. And what I will tell you is, even with, younger teenagers, the most immature behavior I often hear about in homes is with teenagers who do not have any expectations at home, that nothing is asked of them. And when things are asked of them, well, then their behavior suddenly improves. Okay. Because now they feel, somewhat useful. They might not like it, but things improve. The other big challenge I would say with teenagers is the medication piece. And what I teach parents about this is, if your child is resistant to meds that they've been taking for a while and are effective, then stay out of the conversation. Okay. Unless they want you in it, let the teenager speak to the prescriber themselves and let them come up with, a plan. And if they want you involved in that meeting, great. But if not, just let them meet with the prescriber on their own. Because so often, and this is also the fault of some, doctors, that they basically have a conversation about the teenager as if they're not there, and it's the parents talking for the teenager. And when we allow kids to, both younger kids and teenagers, when we allow them to speak with the physician or the prescriber directly, we're teaching them self-advocacy skills, and we're helping them have more of a sense of ownership in this. And I think it's more important that they hear how meds can benefit them and how not taking them can be detrimental if it's not coming from their parents.
That is true. And that's good advice for us clinicians as well. Because usually, naturally, you speak to the parent, won't you, and not really want to involve the young person up until they get to a certain age. But yeah, you're right, because obviously they're the ones who are going to be receiving that treatment. In this case, it could be medication. Um, on that point, you mentioned about consequences, rewards, and things. With young people with ADHD, including detentions as well, for example, in school, is that do you feel detentions, consequences, and all of that, do they actually have an impact on someone with ADHD? Is that going to make them learn about whatever they've done wrong and maybe think before next time in terms of redoing whatever they've done? Does that,
No.
what's,
Yeah. No. Well, because, kids with ADHD live in the moment. And this is why, by the way, I want everyone to understand why individual therapy, play therapy, cognitive behavior therapy, why it's not a recommended treatment for children, because they can't generalize what they learned in a therapy room outside of the therapy room. That's why parent training is a recommended treatment. Okay. Individual therapy or cognitive behavior therapy has only shown to be effective for older adolescents and adults with ADHD. Now, I'm not saying a therapist can't be a source of support, but so many, parents take the kids to a therapist thinking, well, this is somehow, talk to them about their behavior, right? Or talk to them about their emotional dysregulation. And that's not going to do anything, at all. So I'm sorry, tell me the question again with this. I got on a little tangent.
No, yeah, just in terms of like consequences, in terms of like, do they actually learn
yeah.
through these detentions, punishments, taking things away from them and expecting that it's going to have an impact on them, on their behavior, stopping them from thinking next time?
Yeah. So because kids with ADHD live in the moment, they're not going to think back, 2 weeks ago when, I was mean to my sister, I had my phone taken away, so I better not be mean to her now. Right? Because again, they're not going to apply that information and the emotions from past experiences to the present. There's actually a term for that. It's called episodic memory, which is our emotions associated with past experiences. So they're not going to apply that. So, here's the thing, I think there's, at least in the States, and I imagine in the UK, there's been this big push towards, punishments are horrible, and children should never be punishments. There's no society in the world that exists without punishments. Okay. But the one thing I want parents to understand is kids with ADHD tend to be punishment adverse, meaning punishments stop working on them. So what I teach is, rather than punishing them for things, have expectations in place. So like for a teenager, I say have 3 daily expectations for, helping around the house, chores, whatever, and 3, expectations for behavior. And in order for the child to earn the things that they want, they have to meet these expectations daily. And then, and we want them to be successful, and we give them, ample opportunities to kind of self-correct. I call that brain breaks, and with kids, so if they need to get back to a state of emotional regulation, instead of saying, you cursed at me, so therefore you lost, your phone. Well, we say, go take a brain break and come back and talk to me when you're ready. Because if we have daily expectations in place and give them ample opportunities to be successful, well, then if they don't meet the expectations, we can say, hey, you didn't, earn your phone today because, you didn't meet so-and-so expectation. So, and then when the child says, well, that's your fault, you took it away from me, and you're punishing me, we'll say, well, no, that you knew what the expectation was. You just chose not to earn it today. And I hope you'll make a different choice tomorrow. I actually call that language of accountability. So it's teaching kids accountability so they stop placing the blame on everyone else. Yeah. And
there's a few things I want to pick up from that. Let's start with school.
Yeah.
Schools sometimes they try and promote good behavior and things by doing rewarding someone who's been the best student for that week, star of the week for some schools and things like that. For someone with ADHD, I'm just thinking like it could be from Monday to Friday. They expect to behave well and, have detentions, good listening, working hard and all of that. I find a lot of my young people, 5 days is quite a long time, to be fair. You might find that Wednesday, they might do something, there's a minor bleep there. Do we then penalize them that they can't get that reward or star of the week at the end of that week based on someone that doesn't have neuro diverse issues such as ADHD in this case? Can we not make it short term? Can we not say something daily or 2 days, or a space of time of 2 days compared to something like longer term 5 days? Because that's, I don't know, is that unrealistic, having an expectation that someone can behave for 5 days?
Oh, well, it's unrealistic because of the child's time horizon. So time
Yeah.
horizon means your ability to visualize things in the future. So let's say, and I don't remember the numbers off the top of my head, but let's say, 11-year-old, their time horizon is basically, 2 days. For a child with ADHD who's 11, their time horizon is not 2 days. It's, maybe 12 hours. Okay. So if the reward is outside of that 12-hour time period, that's going to be too abstract for them. It's not going to motivate them. So in order to motivate kids, the incentive has to be within their time horizon. So to your point, yes, saying do this Monday through Friday and you can have this on Friday, it's way too long. Unless they're, older teenagers. So yeah, the more immediate, reward there is, the easier it's going to be for them to be successful.
And in terms of dealing with behavior, in most schools, they have a behavioral policy, which I'm sure is. I'm not sure if it's the same in the United States, but over here, that's what we have. And what you find that some children with ADHD are being suspended through bad behavior, or something that they've done, they've said something, swore, through something, and all of that. Some of it could be impulse related. I'm not trying to justify and put everything down to the ADHD, but certainly when you look at it, you say it's definitely a behavior which you constitute the behavioral policy being used. But are we penalizing neurodiverse young people, particularly with ADHD, by punishing them in the same way as you'd punish someone that doesn't have these issues or difficulties?
Yes, because what we're doing is we're punishing them for their executive function challenges, right?
Yeah.
Because they can't visualize 4 days ahead, right? Then they're being punished for that. And I think really what this speaks to is people's lack of understanding of executive functioning and lack of understanding that, ADHD is really, I call it's an executive function developmental delay. So if
Yeah.
people don't understand that so much of this looks willful and doesn't look like, well, no, it's because it's outside of their time horizon, right? They can't be motivated by that.
How can, I'm just trying to see in terms of schools, when they create these policymakers, how can they create something that's going to not penalize individuals that have neurodiverse needs?
Yeah, well, that's the million-pound question, really, isn't it? Here's the thing, at least in the States, what I can tell you is, my experience has been there's not much interest from schools in training educators about ADHD. It's not that the teachers don't want to learn about it. It's that the schools are not going to invest the time or money in educating teachers about it. And this is why I say that ADHD is not taken seriously in our culture. They'll be more than happy to do trainings about autism, but when it comes to ADHD, no, they're just not interested. So this is why we're really stuck here, is because teachers get no training in ADHD, and I would even say, at least here in the States, special education teachers get almost no training in ADHD. So this comes down to, it's not, a teacher trying to be difficult. It's that they're not educated in how to support students with ADHD.
Yeah. Which is sad. Sad to
It
say.
is sad.
Honestly.
Yeah.
Because the same could be said about someone with a physical disability in the school.
Exactly. Right.
Yeah. How would they be treated in that situation? Would they use the behavior policy?
Right.
Yeah.
And I'll tell you, I have a saying, I say that, if a child has autism, it's looked at as a disability. If they have ADHD, it's looked at as a character flaw.
Yeah. Goes back to the stigma of ADHD.
Exactly.
Coming back to family dynamics and ADHD, how does ADHD impact on family dynamics, and what advice would you give to families to improve their interactions?
Yeah, I think the best thing families can do, is just educate themselves a little bit. And, that's why I have, my YouTube channel. I mean, there's plenty of resources out there. I imagine on the NHS website, there's some resources, and, I've seen some other good, websites in the UK. I can't remember off the top of my head. But I think that's really the best thing families can do is just educate themselves so they can understand, what ADHD actually is and how it presents. So we move away from just thinking that the child's doing things willfully or they can't do something, because one of the things, I believe is, we have to help kids feel capable, and the more capable they feel, the better they're going to feel about themselves. So it's really comes down to that. And also understanding that they need to be parented in a way that might not be natural for you, but it's going to benefit them, and it's going to make life at home less stressful for everybody. if they're
And on
parented in a way that works for their brain. Yeah.
right, right. On that point on family dynamics, let's think about siblings and touching on
Mhm.
the point you were saying earlier in terms of a consequence to some sort of behavior, um, and how we shouldn't be penalizing them too much. If I'm a sibling and my sibling is has ADHD, and I can see clearly that they're not having the same consequences as me, do you not think that's going to impact on the dynamics of the family?
Yeah, well, let me say this first. It's funny you brought this up because I actually have a video coming out about ADHD and sibling relationships, because this is the topic I find parents have the most unrealistic expectations about. They'll say things like, well, I want one of his daily expectations to be he's nice to his sister all the time. And I tell them that's completely unrealistic. Most siblings fight sometimes, and you're expecting a child who has problems with flexibility and with emotional dysregulation, right, to be able to contain that with their sibling who they live with and who they can be themselves the most around. No, it's not realistic. But what I do teach is we can have expectations in place, right, of how you speak to family members, including siblings. And the other thing I will tell you is I find a major reason, the number one reason why kids with ADHD tend to provoke their siblings is because they're bored and they don't have enough structure at home. The term I use for that, I call it screaming for scaffolding. So the question is, should we be punishing them because they don't know what to do with themselves when they're bored, or because we're not providing them with enough structure? I don't think so, but I think we can have expectations of how they should treat other people. And I
Yeah,
don't necessarily believe that kids with ADHD should have different, behavioral expectations than siblings. Maybe they need to be modified a little bit, but I don't think they need to be completely different. And I don't think, we need to say, oh, well, he can't help it because he has ADHD. I think that's not a good message to send to your other children, or to your child with
yeah.
ADHD. Yeah.
And certainly in the siblings themselves being educated in terms of their sibling about their condition, ADHD in this
Mm-hmm.
case, also
Yeah.
helps as well as a family to understand that, not trying to use it as an excuse, but that hopefully can go a long way in trying to understand, and for them to understand that my young person, my siblings got ADHD, and this is what ADHD presents and what it is. Also highlighting the positives that ADHD brings, rather than just the negatives.
Yeah.
Um, Let's talk about the concept of boy talk and how it influences your therapeutic approach.
Yeah. What specifically about it?
Well, for our listeners, do you want to tell us what it is exactly?
Which are you talking about, my videos on the channel?
Yeah. Boy talk. Yeah, there's one in
Oh,
boy
the
talk.
dude talk. Yeah.
Do talk. Sorry,
Yeah.
yeah, do
Yeah.
talk.
Yeah.
Yeah.
So let me start off with this. I worked around educators for a long time. I worked around, school counselors and, school social workers for a long time. And, the reality is that, this is a completely female dominated field who understandably the vast majority did not grow up male. And I think as a result, there's sometimes a lack of understanding of how to communicate with boys or how to reach boys in a way that works for them. And I, saw over the years a lot of the language being used, with boys was, I hate to say it this way, but it's kind of overly feminized. Let's tell our friend, compliment our friend and tell them what we like about them. And that's just not organic to the way most boys communicate with each other. So the reason I really got into this was because in the social skills field, which, completely female dominated field, what I saw was there was, it was a primarily male population with a primarily female, group of therapists or speech language pathologists. And what the, boys were really learning is they were learning overly formal etiquette. Okay. They weren't learning how to be more relatable to their same age peers, to their male peers. And I said to myself, nobody else is doing this, so maybe I need to do something about it. So that's really just what I want people to understand is that if you're going to work with boys, they have some different learning needs than girls do, and the way that they communicate is different. The way they access emotional language is different. So we have to meet them where they're at if we want to educate them about how their brain works, if we want to teach them how to get along with other kids. And that's how the Dude Talk playlist in my YouTube channel, a lot of it is me teaching kids during my school year programs or camp. And I want to explain the reason why I have only boys in the school year programs and camp. It's not because I don't want to work with girls. I would love to, but the reality is I didn't grow up female, right? So I don't understand how girls form friendships the same way that boys do, because I didn't grow up with that experience. The other thing is, I don't like when I see group dynamics where it's like 8 boys and 1 girl, or when I used to do them co-ed, I would have, like maybe like 8 boys and 2 girls, and the 2 girls didn't like each other, so that was like awkward. So I believe that kids need friendships with peers of the same gender, and I think they value that, and particularly as they get to 11, early adolescence, they want that. And again, we have to meet them where they're at, and that's why I focus on boys and with the social stuff. Yeah.
How's that been received, just from your
Yeah.
listeners? And
It's funny. When the first time I ever presented on it, I was presenting at a conference that I knew was going to be, there would be no men at the conference, basically. And I was terrified because I thought that, that these women were going to lash out on me and say, you horrible chauvinist pig. And I was really surprised by how receptive they were to it. But what really struck me was when I started doing the school year programs just for boys, you know, I had no idea what the response was going to be from mothers. It wasn't even fathers, it was mothers who were so excited about it and said, I've been looking for something like this for so long. And what I realized was, for a lot of these boys, they were in these social skills groups where they were learning, overly formal etiquette. My joke is always that, in social skills groups, kids learn how to function at Windsor Castle, not with their peers. Because Americans
yeah.
actually know what Windsor Castle is. So yeah.
Very, very good. I like that.
Yeah.
So lastly, what message would you like to give to parents who are currently struggling to find effective help for their child with ADHD?
Yeah. So a few things. I respect whatever decision a family makes about medication, and I always want parents to make medication decisions based on data and research, not on their emotions, not on, the opinion of their, sister or their mother or whomever. Make medication decisions based on research data. And the reason I say that is because we have a lot of long-term research data on people with ADHD who are medicated versus unmedicated. And what the research data shows us is there's a lot more negative outcomes for people with ADHD who go unmedicated. The most concerning one is that they double their chances of developing a substance abuse problem. It doesn't mean they will, but they're at double the risk of developing a substance abuse problem. So that's number one. Make medication decisions, based on data, not your fears, not your emotions or others' opinions. Number two, again, is understand there's a lot of great resources out there to educate yourself, about ADHD. Some of them will resonate with you, some of them will not, and that's okay. You have to find what you feel works for you. But the other thing with that is, you might find an approach that you feel, okay, feels more natural to me. This is my style. But then the question becomes, is this helpful to my child? Because what I've seen, increasingly is a lot of parents who have, taken this advice from people who are teaching this kind of permissive, indulgent parenting approach, which encourages parental accommodation. And what I often hear is, things in my house got worse than they ever were, and then we had to work even harder to turn things around. So what might be most comfortable for you might not be what's best for your child. That's the other big piece. And I think the last thing I would say is that, just, all kids grow and mature over time, and, this will get better, but we can't just let things go. If your child struggles socially and they're 8, we can't just hope that this will magically disappear in a few years. We have to help them learn. And again, that families have the biggest role in this, and the more family members involved, parents, grandparents, extended family, the better.
I agree. And I think that's the whole concept of the NVR, the nonviolent resistance. The whole
Yes.
community is raising the child and making it known to the young person that it's not just us, it's everyone else who's there to support you. And we are here not to try and criticize as much, but it goes back to the whole essence of community and how we raise children, how our parents used to raise us and all of that. And I think we've lost that. Now people are
We have.
struggling in isolation.
Yes.
Yeah. So I think,
I believe in the old African proverb, it takes a village to raise a child. I still
100%.
believe that that's true. And we've, unfortunately, not anybody's fault, but we've moved away from that. Yeah.
Yeah, absolutely. Um, And anything else that you wanted to sort of let our listeners know what you've been up to, what to look out for, and obviously you can also mention your website and contact details and things
Yeah.
as well.
So, as I mentioned, anyone's welcome to visit my YouTube channel. Just type in ADHD Dude. I also have a podcast now with one of my colleagues. His name is Mike, and he's a speech language pathologist. So we talk about different topics, and you can find that on any podcast platform or YouTube. It's called the ADHD Guys Podcast. So we put out a new episode twice a month, and that just kicked off. And website's ADHDdude.com if you want to learn more about what I do.
And are you giving talks at any upcoming conferences at all?
I don't think any, no, because all the conferences tend to be the same time of year in the States. Yeah. So probably I'm doing more, smaller trainings, for, private schools for students with learning differences, but yeah, probably not till next fall at the ADHD conference. Yeah.
Okay. And for families that are over here in the UK, do you offer support to families outside of the US as well?
Absolutely. And actually, with the membership site, when I do these office hours a few times a month, I do them at times that families in the UK can participate, because we do have a lot of members in the UK. So like tomorrow, we'll have them, it'll be, I can't do military time, I can't do European time, but 7 p.m. London time.
Perfect. Amazing.
Yeah.
Well, I'll let you go. And great catching up.
You too.
We'll keep in touch. Obviously, I've got your contact details and things. So yeah.
All right.
Enjoy
Excellent.
the rest of your day.
Yeah,
Cheers,
you too.
Ryan.
Thanks for having me. Appreciate it.
No problems.
All right,
see you later.
Take care.
Take care. Bye. Bye. Bye.